Good afternoon. Welcome to the third in a series of webinars the Workers' Health and Safety Center is hosting on worker health and safety issues related to COVID-19. I'm Susan Daub, a Senior Training Services Representative with the Workers' Health and Safety Center, Ontario's only designated health and safety training center, successfully operating now for more than 30 years. For those of you who have questions, please submit them with the Q&A tab at the bottom of the screen. I will be answering questions at the end of the presentation. For those workers still working outside of their homes during this challenging time, we have been working hard to answer your COVID-19 questions individually, and thorough information is posted on our website. Understandably, questions around reasonable precautions and what principles should guide these precautions have been on the minds of many. Hence our decision to offer this webinar. So let's get started. Health and safety law requires employers to take every reasonable precaution to protect workers in the circumstances. But what is reasonable when workplaces are confronted by COVID-19? In this presentation, we will consider the precautionary principle that should guide all action, a hierarchy of controls that should also help determine the most appropriate hazard controls to be used in the workplace, and then we will provide some examples of reasonable measures to help prevent worker exposures to COVID-19 based on these principles. The precautionary principle has its roots in the environmental movement, first articulated in the 1970s. Since then, it has been adopted in many international treaties. While there are many definitions related to this principle, likely the best known is included in the Wingspread Statement on the Precautionary Principle. It reads, when an activity raises threats of harm to human health or the environment, precautionary measures should be taken, even if some of the cause and effect relationships are not fully established scientifically. In other words, what should trigger action is the clear signs of harm, not the scientific proof of harm. This is especially important when waiting, when doing nothing will have a catastrophic effect. Or, as Sandra Steingraber writes, the idea of the precautionary principle has been expressed over time as first, do no harm. Better safe than sorry. Look before you leave. Now, let's fast forward another 15 years from the time that statement was released. Following an outbreak of severe acute respiratory syndrome, SARS, which began in a Toronto hospital in March 2003. 44 people were killed. 3 of these were healthcare workers, 2 nurses and a doctor. 45% of Ontario's 375 SARS cases were also healthcare workers, the single largest group to be affected. To help address this disaster, the Ontario government appointed an independent commission of investigation headed by Archie Campbell. Justice Campbell ultimately concluded, if the commission has one single take-home message, it is the precautionary principle that safety comes first, that reasonable efforts to reduce risk need not await scientific proof. Ontario needs to enshrine this principle and enforce it throughout our entire health system. One of the many debates during the SARS outbreak was how the illness was transmitted, by large droplets or airborne particulate. A similar debate we've heard during the COVID-19 crisis. Justice Campbell wrote, the point is not who was right and who was wrong in this debate. When it comes to worker safety in hospitals, we should not be driven by the scientific dogma of yesterday or even the scientific dogma of today. We should be driven by the precautionary principle that reasonable steps to reduce risk should not await scientific certainty. Until this precautionary principle is fully recognized, mandated, and enforced in Ontario's hospitals, workers will continue to be at risk. He also observed, if we do not learn from SARS and we do not make the government fix the problems that remain, we will pay a terrible price in the next pandemic. And so here we are. Following the SARS Commission report and its recommendations, the principle was enshrined in the Health Protection and Promotion Act. Citing Section 77.7, Section 2 of this legislation, recent directives from the Chief Medical Officer of Health have invoked the precautionary principle when considering personal protective equipment in healthcare facilities for the care of suspected, presumed, or confirmed COVID-19 patients. But what about situations where patients and/or members of the public are not exhibiting symptoms? And what about workers outside of healthcare settings? Despite the best attempts of workers and their reps, precautionary principle was not included in the Occupational Health and Safety Act following the SARS Commission. Given that scientists are still working on determining the specific routes of transmission for COVID-19, the question before us is, what are reasonable precautions in the circumstances? When applying the precautionary principle to COVID-19, employers should assume that anyone might be carrying the COVID-19 virus, as symptoms don't appear right away, if at all, and any commonly touched surface may be contaminated. For workers who must work in close proximity to patients, customers, or other workers, appropriate personal protection must be considered. We will revisit the issue of PPE later in the presentation. The hierarchy of controls is yet another principle that should underpin employer efforts to take reasonable precautions during COVID-19. A number of regulations supporting Ontario's Occupational Health and Safety Act clearly require the adoption of a hierarchy of controls approach. These include the Designated Substance Regulation, the regulation controlling exposure to biological or chemical agents, and the province's noise regulation. Under these regulations, personal protective equipment is deemed to be used only as a last resort or only as a temporary measure. The hierarchy of controls begins with eliminating hazards at their source, such as substituting with safer alternatives or processes. When the hazard cannot be eliminated, controls must consider all the pathways of the hazard and attempt to establish controls between the hazard and the worker. In addition, administrative controls such as cleaning and housekeeping, along with worker training, are also usually required. As discussed previously, PPE is to be used as a last resort, as it often doesn't provide adequate worker protection, and in fact, it can create additional hazards. As we can see here, generally, the closer the control is to the hazard, the more effective it is in protecting the worker. Before applying these principles to control potential COVID-19 exposures, a proper hazard assessment should be conducted in the workplace. Joint Health and Safety Committee worker members and/or worker representatives and/or union reps, where there is a union in the workplace, should all be involved in carrying out the hazard assessment. Working with the employer, they should examine all the ways in which workers may be exposed to COVID-19. Of course, when the workplace hazard is biological, like COVID-19, and spreads from human to human and contaminated surface to human contact, control at the source is difficult. Elimination or substitution of a virus from a workplace which is still open during a pandemic is not possible. As has been done, it is feasible, though, to close non-essential workplaces and to arrange for people to work from home where practical, thus eliminating the potential for workplace exposure and limiting transmission, especially when individuals stick to physical distancing and essential hygiene practices at home and in the community. Engineering controls most often involve isolating workers from hazards. For COVID-19, employers should consider a range of measures, including high-efficiency air filters on HVAC systems, increasing ventilation rates, isolation of infected patients or residents, and where available, this should occur in airborne infection isolation rooms. Many workplaces are implementing physical barriers, such as plexiglass barriers, in places where closer contact between workers, patients, clients, and customers is required. These types of barriers should be considered as control measures. Administrative controls are measures to limit the risk of virus transmission, including safe work policies, procedures, and practices. Worker training and other means of sharing information is also important. It is crucial that workers understand the precautions which are being taken to eliminate exposure and control transmission. These include a combination of social distancing measures and hygiene and cleaning. There are a number of social distancing measures workplaces can consider. These include restricting workers and customers who are unwell from entering the workplace, and reducing the numbers of people in the workplace. For example, postponing non-essential work tasks, staggering or shortening shifts, shortening work hours, and limiting the number of customers admitted to the workplace at any one time. When utilizing these controls, it is important to take measures to maintain a 2-meter distance between clients and workers. Examples of these measures include installing floor markers or employing staff to manage the distance in lineups, etc., while ensuring workers maintain a 2-meter distance from each other as well. Other examples include creating dedicated workstations and equipment for each worker, and ensuring all shared resources are cleaned thoroughly between use. More on cleaning in a moment. In addition, isolate any workers who become ill at work until they can safely leave the workplace, and then clean and disinfect their work area as soon as they leave. With respect to reporting, all known positive tests for COVID-19, employers in the non-healthcare sector have clear reporting obligations, as shown here under Section 53 of the Occupational Health and Safety Act. In the healthcare sector, outbreaks must be monitored and reported to the Public Health Unit as required under public health laws. It is important that clear reporting and tracking measures for COVID-19 are established and followed. There is a lot of advice on how to control COVID-19 exposures, and it focuses on what workers should be doing. While workers certainly have a role to play, even when it comes to personal hygiene, employers have an obligation to take reasonable precautions to support the hygiene practices of workers, including this list of precautions. Take a moment for you to read those over. Cleaning and disinfecting. For greater detail on this subject, you will want to consider reviewing documents which we have posted on our website, such as the one regarding cleaning and disinfecting non-healthcare workplaces. All of our COVID-19 resources are based on advice from Canadian and US public health authorities. Here are a few details regarding effective measures for cleaning and disinfecting non-healthcare workplaces. The Ministry of Health and Long-Term Care and Public Health Ontario have also issued several separate guidance documents and protocols for workplaces in the healthcare sector. Among these documents is a comprehensive document entitled Best Practices for Environmental Cleaning for Prevention and Control of Infections in All Healthcare Settings. Links to these documents will be included in the notes to this presentation once we post them on our website later today. In healthcare settings, personal protective equipment is essential for all interactions with suspected, presumed, or confirmed COVID-19 patients. In other occupations, working during the COVID-19 pandemic, this kind of protection against COVID-19 may not be necessary. In some occupations, like construction, workers wear PPE every day to protect against work hazards other than COVID-19. But additional PPE, such as surgical face masks and rubber nitrile gloves, can cause a false sense of security and offer limited protection. Improper use can also increase the risk of infection. As such, when it comes to the COVID-19 virus, public health authorities tell us PPE is not a replacement for social distancing, thorough and frequent hand hygiene, and cleaning work surfaces. As mentioned earlier, while working with worker reps and union reps where there is one, employers should first examine all of the ways in which workers may be exposed to COVID-19. Then consider social distancing measures to combat potential exposures. The measures we have discussed are a good place to start. If, after exhausting these measures, additional and appropriate PPE is deemed necessary and a last resort, great care must be taken in its selection and use. For more information on PPE for non-healthcare workers, you can find the following documents posted on our COVID-19 webpage: Gloves at Work, Safeguards for Workers, and Respiratory and Eye Protection at Work. Both of these are safeguards for workers confronting COVID-19. When considering PPE for healthcare workers, let's return to the lessons learned from the SARS outbreak. To make his point about the importance of the precautionary principle during a pandemic, Mario Pisami, a senior advisor to the SARS Commission, compared the experience of Vancouver and Toronto hospitals. The SARS Commission found, unlike Toronto hospitals, Vancouver hospitals had effective infection control protocols in place based on the precautionary principle. When dealing with an undiagnosed respiratory illness, Vancouver hospitals had a policy of automatically using the highest level of protection and scaling back as the situation was clarified. Consequently, in Vancouver hospitals, there were no deaths and disease transmission was contained. In our current situation, we would do well to remember this contrast in experiences. certainly, as we have seen in Ontario long-term care facilities, workers and the residents they provide care for are not receiving the protection they require. And as a result, COVID-19 cases have reached alarming levels. In his final report for the SARS Commission, Justice Campbell entitled one of his chapters, "It's Not About the Mask." The point he was trying to make was that although N95 masks are important safeguards, masks, or the lack of them, were just a lightning rod for what was really ailing the health and safety system in the province. Namely, poorly functioning joint health and safety committees, inadequate training, and a failure of both internal workplace responsibility systems and exterior enforcement from the Ministry of Labor. Are we any better off today? In many respects, it certainly doesn't seem so. It is too late for those who have already been killed by the COVID-19 virus. But in the spirit of the day of mourning for workers, which is almost upon us, let's mourn for the dead, but let's also recommit to fight for the living. When taking action, let's be guided by the precautionary principle and the hierarchy of controls. Thank you all for joining us here today. I hope you found this information useful and that it serves to assist you in protecting essential workers during this difficult time. If you could fill out the short survey, which I'm sending out now, and then submit it to us, that would be most appreciated. Again, I will answer questions in a few moments, and for more information, please be sure to visit our COVID-19 resources page. Now that we have time, I can take a few questions. If I don't get to your question, please be assured I will email you a response, or we will email you a response directly, or cover your question in a document of Q&As, which we will prepare and post in the following days to this webinar. I'm just going to take a look and see what questions we have here. Question 1, in healthcare, employers are following public health protocols for PPE, but we are still finding multiple healthcare workers testing positive. Can we not ask for a higher level of PPE? That is a really great question. Again, we don't know everything there is to know about COVID-19 at this point and all of its routes of transmission. And I'm glad you asked for a higher level of protection, because what the Act says, if we go back to it, is the employer must take every reasonable precaution in the circumstances. So you can always go above and beyond a lesser protection. So yes, if there are greater protections, you can certainly ask for them. Again, I would start with going to your supervisor or employer and then making that request. And then if necessary, going to your worker joint health and safety member or committee member, and they can also make recommendations to the joint committee, which the joint committee can put through to the employer for greater protections. So certainly you can make that request. I'm going to go to the next question. Does our employer need to provide us with face masks each time we remove it, replacing it with a new clean one? I work auto line worker going back to May 4th. Let's see. That question, when you're not working directly with patients, I'm not 100% sure on whether that is a suggested precaution or not. I would suggest that we will get back to you with that email later. There are issues with taking off and replacing masks, and sometimes that can risk additional problems and additional transmissions as well. So I really don't want to get into the specifics of that, but it's a great question and we will certainly get back to you with more detail. Question 3, What about healthcare workers who cannot maintain social distance with patients while treating them? In the case of patients who are not suspected to have COVID-19. Well, again, as we mentioned earlier, especially in a healthcare setting, you have to assume that anyone that you're dealing with, whether it be a patient, client, coworker, may have COVID-19 because the symptoms don't always show right away, right? So if you are doing hands-on work or keeping less than the distance required, then I would suggest that you need additional PPE. So take a look at that. Again, there's more resources on our website, or if we don't have them directly, we can get them back to you. But yes, whenever you're not maintaining that social distance, then you have to make sure, and especially if you're performing personal care, additional protections may very well be required. I'm not sure about the specific type of care that you are providing in terms of that level of engagement with the individual. That would make a difference as well. Okay. Question 4. My workplace is having the workers fill out a questionnaire before they enter the workplace. What is there to stop the worker falsifying the answers just to be able to return to work and possibly subject other workers to infection? And that's a great question because you're absolutely right. Here we're relying on the honor system of people saying, yes, I am experiencing symptoms. And when people are in a really tight economic crunch, there is nothing other than a person's conscience, I suppose, to stop them from telling the truth. On the other hand, they may well be telling the truth. I may go to work today and feel absolutely fine, have no symptoms whatsoever, and say, you know, when I'm answering that questionnaire, no, I'm fine. And then later on, I may find out that I in fact had the disease and I could be infectious to other people. So again, these are protections that employers are trying to put in place, but we cannot assume that they are going to protect us. And that is why we have to ensure that social distancing or some sort of barrier is between us and those co-workers and or clients and so on and so forth, because we must assume that they may have COVID-19. Question, will you speak to the amount and type of information regarding COVID-19 testing within a workplace that a Joint Health and Safety Committee would expect to receive? So I'm not sure, hang on for a second. Phone went for a little bit of a ride there. I think if you look back to one of the earlier slides, and I'm not sure if I can bring that up right now. Let's take a look. If I can. There was a slide that I had up earlier, and it was about the reporting procedures. And I'm not seeing it right here, so I'm not going to take the time to try and find it. But we will post the PowerPoint later on our website, and it says specifically in there what the reporting requirements are that the employer has to report to the Joint Health and Safety Committee. Here it is right here. Let's see if we can pull this up. I'm not sure if you could see this before. Employers must report all known positive test results for COVID-19 to the Ministry of Labor in writing within 4 days, to the Joint Committee and safety representatives and trade union if applicable, and that would be within that time period as well. So they should also be working with Joint Committee members on setting up the testing processes, when and how those tests are done, and dealing again with the results. Hopefully that will answer your question. If not, please feel free to email us. Question 6. Can we insist that the MOL inspector visit a workplace to investigate a complaint or work refusal? Okay, so we will be posting our PowerPoint from the presentation we did earlier this week on work refusals. I believe that what Wayne mentioned when he talked about that is right now, sometimes the Ministry of Labor aren't physically coming out to workplaces. They may try to deal with the work refusal over the phone. So that would be with respect to both a complaint or a work refusal. So you may be able to get them on the phone, but they might not physically come out to the workplace, especially during this time when they're trying to maintain social distancing and things like that. But if there is a work refusal process in place and it's taking place, absolutely that should not, stop the process from taking place as it is needed to do so, including involving the Ministry of Labor. There are many more questions, but we are, I'm afraid, running out of time. But please, we have a contact us on our website. Submit your questions there if you don't get them on in the Q&A during this presentation. And again, we will make every effort we can to help you in your efforts to stay safe and healthy during this time. Again, thank you so much for taking your time to join us today. It's been my pleasure, and have a great and safe day. Take care. Bye-bye.